And we are with Dr. Rachel Villanueva. She is the president of the National Medical Association and also clinical assistant professor at NYU School of Medicine. How are you today?
Oh, great. Thank you for having me here today.
Thank you for being here. You're here. We reached out to you because we're going through COVID fatigue and also COVID TMI. There's a lot of information coming out about COVID, and now we have the variant. Before we get into questions about that, want to find out a little bit about you and what your position is, Dr. Villanueva.
Okay, so I am an OBGYN in private practice in New York City, and I live in Harlem, and I'm a born and bred New Yorker. And I am currently the president of the National Medical Association. And the National Medical Association represents Black physicians across the country, promoting interests of Black patients and underserved patients since 1895. So we have a very, very long history. We are committed to the health of Black communities. And right now, at the heart of that is putting an end to the COVID-19 pandemic. So that's why this conversation is so important to me.
Very important. And can you provide our listeners with any information on the Delta variant, what it is and how it is different from the initial COVID strain?
Sure. I think overall, the first thing I want to say is I think we shouldn't get bogged down with so many details. Like you just said, we are getting so much information. Every minute of the day, we could find out some new information about COVID-19. And I think the most important thing right now that I could say, and I'm going to say it over and over again, is for those individuals that are not vaccinated to get vaccinated. They're safe, they're effective, they're free. And this is the way we are going to end the pandemic and get back to normal life. So I just want to start off by saying that before we say anything else. But basically, like any virus, that we know viruses mutate or change. That's not unusual. We know that from our experience with the flu. Every year we have a different flu vaccine because there's a different strain of the flu. So the Delta variant is just a different strain of this COVID-19 virus that we were first introduced to. Now it seems like forever ago, but so it's just a different strain of that same virus. What's so important about it? It's more easily transmissible. So you get it easier than you can get the first one. And I think that's what's so important right now among unvaccinated people in our country, is that people are getting this Delta variant very quickly and are getting very sick from it. And so that's why getting vaccinated remains our number one priority as health professionals.
We are talking with Dr. Rachel Villanueva. She is the president of the National Medical Association. We are talking about COVID-19 and the variants and getting vaccinated. You remember we went through a period where there was a flu strain that we were being vaccinated for, and then another strain of that flu came out. So people who got vaccinated for the flu still got the flu, another strain of the flu. That's pretty much works how it's working with COVID-19 and the Delta variant.
Yes, I think a couple of things to just keep in mind is that even though fully vaccinated people may get infected, the chance of that still remains fairly low. So that's really important. But overall, the most important thing, severe disease, getting hospitalized, dying from COVID-19, the vaccine still protects us, even with this Delta variant, about 99 point something %. So we're still so protected by getting this vaccine. Even though this variant is a little trickier than the first one, we're still very protected from the things that are really most important, staying out of the hospital and keeping ourselves alive.
That's right. That is so right. And you may have already partly answered this question, but why do you feel there is a reluctance in certain communities towards getting vaccinated? We've heard COVID hesitancy, vaccine hesitancy from day one. And so why do you think there is such reluctance still?
Well, I would say that I would like to use the term lack of vaccine confidence as opposed to hesitancy, because hesitancy almost tries to blame the person that may have questions or concerns about the vaccine. And we don't want to do that. We want to make sure that if individuals have questions about the vaccine, how it's going to affect them or could affect them if they have medical problems, we want to make sure everyone gets their questions answered and ultimately gets vaccinated. So I think, especially in our community, in the Black community, right? We have not always been treated very well in the healthcare system. There's been barriers to access for us to get adequate care. There's some bias in the system inherently, and even structural racism. And so there are reasons why our community may be a little less confident in something that comes to us. However, we have to really keep in mind that this vaccine is a vaccine for everybody. It's not specifically targeting the Black community. This is the vaccine for everybody, and this is the way that we're going to get back to normal life. So I think it's really important that if people have questions, concerns, that we listen and validate those concerns, and then encourage people to get vaccinated.
So true. We are with Dr. Rachel Villanueva. She is the president of the National Medical Association. You're listening to the Black Information Network, the program, The Black Perspective. I'm your host, Mike Island. And as the fall season starts ramping up in school, coming back into session, I'm sure you want to do your part to encourage students and teachers to stay informed on the latest COVID information and to get vaccinated and protect themselves. Now, as this season is getting underway, why is it important for teachers and students of approved ages to get vaccinated?
It's really so important for everybody over the age of 12, that 12 years old that's eligible to get vaccinated, to get vaccinated. That's the way we're going to keep each other safe. That's the way we're going to prevent even more tricky variants from coming about. So it is really important, especially in the school system, because for all of those children under the age of 12, all those vulnerable children, they can't get vaccinated yet. And that's really the way we can protect them in the school system, is for teachers, staff, and students that are able to get vaccinated, really to protect each other, so you don't give anything to someone at school, so you don't bring anything back home to your own family, but also to really protect those younger children that do not have the ability to get vaccinated yet.
Some pregnant moms are concerned about getting vaccinated. What are recommendations for them?
Right, so that's my area of expertise, because I am an OBGYN, so I take care of pregnant moms every day. I ask everybody in my office if they're vaccinated, because it's so important, pregnant or not, but especially for pregnant women. Pregnant women are at higher risk for having severe disease and illness due to COVID-19. So it puts not only them at higher risk, but their babies at higher risk. So getting vaccinated is really, really important. We definitely understand that moms even have an additional concern, because they're not only concerned about themselves getting vaccinated, but the impact on their pregnancies. And there's a current registry for anybody who's gotten vaccinated that became pregnant or while they were pregnant. The safety, all the data so far looks great, that it's safe. There's no increased adverse outcomes for pregnant women, no matter what trimester they get the vaccine. So it's really important to get vaccinated for pregnant women. Also, we find that they provide some immunity to the baby through the placenta. So they're not vaccinating, but the vaccines are protective against babies as well. They're also able to protect babies through their breast milk if they're vaccinated. So those antibodies are providing a lot of good protection and needed protection, because babies have very immature immune systems when they're born. So they're really susceptible to the virus if they're exposed to it. The CDC has recommended that pregnant women get vaccinated. And then most importantly, the governing bodies of obstetrician and gynecologists, who are the people that take care of pregnant women, they've recommended that pregnant women get vaccinated, as well as the high-risk doctor governing body. So everybody is in agreement that it's extremely important for pregnant women to be vaccinated.
We are so glad that you are in that area of expertise. You answered that question so thoroughly well. Just about every question, every version of that question that I've heard, you nailed it. So we thank you so much for that answer. Dr. Rachel Villanueva, she is president of the National Medical Association and also a clinical assistant professor at NYU School of Medicine. We are so glad to have you on the program this morning, and thank you for that answer. Now, another question, whether you've run into women pregnant or not, if they've already had COVID, do you need to be vaccinated again? And I guess that's for everyone.
Yes, I think that's a really important question that a lot of people have concerns about. And yes, even if you've had COVID-19, you should get vaccinated. We know that actually the vaccine may provide even better immunity to you than your natural immunity, but we definitely know that natural immunity will decrease over time. So you will not be, quote unquote, fully vaccinated just from having had exposure to the virus. So it is very important, especially with this Delta variant. The fact that you've had it doesn't mean you can't get it again. So it is really important to understand that getting the vaccine for everybody eligible over the age of 12 is crucial at this time.
You know, I see so many masks being worn incorrectly, just over the mouth and not the nostrils. What are the latest recommendations for mask wearing, and are there other recommendations to help slow down the spread of the virus?
Right. So we have to keep in mind that even though the vaccine is probably the cornerstone of getting over the pandemic, we can't forget how important masking is, social distancing, and washing hands. So all of those mitigation strategies that were the only things that we had before the vaccine, those are still really important right now. And yes, it's really important for you to wear your mask correctly. So not as a chin guard, but over your nose and your mouth.
Yeah.
And we know now that it's important for people, even fully vaccinated. And I know this comes as such a, at a time where we're all so tired of wearing masks. Even fully vaccinated people in high risk areas should be wearing a mask indoors. And what the recent research shows is that even fully vaccinated people can, even though it's happens not often, can transmit the virus. So if they've been exposed, they may not even be really sick and maybe feel like they have a little cold or not even anything, they can transmit it to somebody else. So in those close quarters, indoors, definitely wear a mask, vaccinated or not. And they're also the CDC is also recommending that for schools, for children, especially because we know those children under 12 cannot get vaccinated, that all staff and teachers and children should also be wearing a mask to protect the children.
I was vaccinated in March, and a lot of people know that, and they ask me, why am I still wearing a mask? And I tell them, because I don't want none. Don't want no trouble. That's my number one answer to them. But it is very important to mask up even after you've been vaccinated. Sometimes I think some of the things we should have been doing all along, washing our hands frequently, taking all those precautions, have actually kept me from getting the sniffles even. So sometimes I think all that has helped. So I'm going to keep doing that after COVID.
Absolutely. I feel the same way. I didn't have a cold once this season, this winter. I felt great. So I'm with you. I'm definitely going to be wearing my mask for a long time to come.
That's right. Dr. Rachel Villanueva, she is the president of the National Medical Association, and she's talking with us all about COVID and breaking it down for us, what I call COVID TMI. And she's nailing it this morning for us. You recently participated in the We Can Do This virtual media briefing. Can you tell us about the We Can Do This campaign?
So the National Medical Association is so overjoyed, happy, pleased, everything you could say to be part of this campaign. Because really what it does is it is a national campaign through the Health and Human Services Department to educate and increase public confidence in the COVID-19 vaccine. And also educating people to continue those prevention measures that we were just talking about, masking and social distancing. And it's based on using trusted messengers. So for our association, it's those brown and black doctors that take care of our community already. So it's your local doctor that helps with your hypertension and diabetes, and especially in those areas that are the hardest hit, so that have low vaccine uptake, and especially in the Southeast, especially in our community, we need to encourage our patients to get vaccinated. So it's using facts, it's using science, it's giving people credible information, not all that disinformation and myths that are making people confused. It's really using science and data to have a conversation with our patients and to encourage and educate people, and hopefully have them get the vaccine finally. So it's really, really, really an important campaign.
We are so appreciative of the information you are giving us on today's show. What are some sources for getting the latest and most accurate information on the COVID virus? I know there's a way to contact your organization, and we want to get that so that we can keep giving that throughout our time on the network.
Sure. Our association is nmanet.org. It's the National Medical Association. You can find information on our website. You can find information if you're looking for local physicians in your area, if you're looking for a physician of color. So we'd be happy to help with that. Related to vaccines, vaccines.gov is an important website where you can find information about vaccines, questions that are answered from credible sources, so factual information, and also can help you find a place to get vaccinated if you're having difficulty finding something in your area. And then also cdc.gov. So the CDC website has a wealth of information. All of that is factual, scientific, credible information, and it's updated sometimes daily with whatever new information there is. So the most updated information about the virus itself, about the vaccines, about safety, that's all on the CDC website as well. So vaccines.gov and cdc.gov and nmanet.org.
There you go. We're so glad to have you with us, Dr. Rachel Villanueva, President of the National Medical Association, Clinical Assistant Professor at the NYU School of Medicine and OBGYN. So thank you so much for being with us, and things change. Maybe a month from now, we'll have a different conversation.
Absolutely. Thank you so much for having me. I will be more than happy to come back anytime.
Thank you.